Millions of Americans will see steep health insurance cost hikes next year unless Congress strikes a deal on expiring Affordable Care Act subsidies. News Channel 11's Jeff Keeling has been following this story for weeks and has a new perspective on how health care providers might be impacted if the cuts stay in place. Jeff?
Yeah, Casey, I'm learning about lots of impacts, but also that financial subsidies are likely to be changed, at least some, before it's all said and done. I talked to Ballad Health's Chief Population Officer and learned that if subsidies end, the pain will hit hard for both patients with ACA insurance and for providers.
These are very big hits. In some cases, their insurance rates can double or triple. And so we would prefer, from a patient perspective, that they were given time to adjust.
Tony Keck, Ballad Health's Chief Population Health Officer, says if there's no deal to extend Affordable Care Act insurance subsidies or create some alternative, millions of patients' pain will also impact providers.
Several million of those will actually drop their insurance completely, become uninsured.
If local primary groups drop those patients who can't pay, that hurts their bottom line at a time price pressures are already increasing.
It's becoming very difficult for healthcare providers to stay in business. This becomes one more hit to physician groups throughout the region.
It could hit Ballad's primary care operations as well.
We routinely get referrals from the for-profit physician groups that do not want to serve people who don't have insurance, and they come to us.
If their incomes are below 225% of poverty, their care at Ballad is supposed to be free.
We'll have to spend more money within Ballad to provide that care. That means that money we were going to spend maybe on expanding services elsewhere gets redirected towards patients that can't pay.
Keck thinks some cutbacks from the extra subsidies that started in 2021 are likely.
Do you do it overnight, or do you do it over the course of 2 or 3 years so people can adjust their spending? And I think that's what is going to be debated during this whole conversation in Congress.
He says any long-term compromise risks particularly hurting areas like this one.
Who they target is, I think, a really important conversation. And so there's been lots of unintended consequences, I think, on rural communities, on low-income communities. And so I think that's where the debates will happen.
Senate Republicans agreed to a vote on some type of ACA fix within a month as part of the deal to end the government shutdown. ACA patients have until mid-December to pick 2026 coverage or risk getting shut out of the market. And as of right now, many will see big cost increases come January.